Now, we all know that expert help with dependency on alcohol and drugs is crucial to giving them up. But one leading treatment provider recognises that also offering mental health services will increase the chances of a broader behavioural change. Paul Brennan visited Addaction to find out why challenging the current system could save lives.
Kieron Allen is a support worker with Addaction, a national drug, alcohol and mental health treatment charity. But originally he came here for help. After losing his leg in a road accident, he became addicted to painkillers, then heroin, and plunged into a 30-year battle with drugs, which even led to a suicide attempt.
I just couldn't handle anymore. I just couldn't stand the weight of what I was hiding from my family, what I was doing to myself. I'd suffered many hospital inpatient admissions as a result of it, and I just got so fed up, and I just swallowed as many tablets as I could.
Kieron says his life was transformed by Addaction, but his complex battle with both drugs and mental health problems is far from unique. According to a study by Imperial College, 4 in 5 people on substance misuse programs had a mental health issue in the last year, but only a minority are being treated for both. That's why Addaction says the system isn't working and things need to change.
What we're looking for is for influencers and people in government to actually start paying attention to what the people that actually use our services are saying to us. And what they're saying is they don't want to just be looking at one small part of their lives, like their drug use or their alcohol use. They want to be looking at everything in total. Whereas what happens now is a running sequence of different types of services, which inevitably mean there are opportunities for people to slip out, fall back, and have to redo that all over again.
By addressing coexisting problems both collectively and holistically, Addaction says outcomes have multiple successes.
Not only do people reduce their prescribed methadone dose, but also they improve their physical health, particularly their chest problems and treatment for their liver disease as well. Also mental health outcomes all improve, particularly around anxiety and depression and their general well-being. But really key to that and underpinning it is that they actually do more useful things with their time. So they engage in different groups like allotments, and they go out on walks in the countryside, and they get debt advice, and we support them with their housing so that they have a more stable base.
Early intervention is seen as key, and Addaction has young volunteers helping with teen pregnancy education. It also runs a mind and body programme aimed at young people involved in or vulnerable to self-harming behaviours.
It's really, really important to have early intervention. We have a situation where 3 out of 4 young people identify that they are very anxious about speaking to their peers in relation to self-harm or in relation to mental health in general. What we've got is a situation where they can then speak to our professionals and encourage them to speak to other people so that they don't feel so isolated and that they don't feel so stigmatised.
Looking to the future, Addaction's employment, training and education groups help people not just rebuild their confidence, but their lives too.
What we would really like to see is people joining up budgets so that services can be purchased that cover a range of different issues, so that are looking at drug and alcohol, looking maybe at smoking, looking at mental health services, maybe looking at sexual behaviour. So all the different things that people need to look at when they want to change their lives for the better.
There's no such thing as a hopeless case in addiction. There is help, and who knows what form it's going to come in, whether it's signposting to other services, whether it's getting treatment here. If I can just help one person comes in here as a result of what I do and gets something, then yeah, job done.